So my name's Dr. Christopher Fox. I'm a consultant haematologist at Nottingham University Hospitals with a major interest in lymphoma and CLL and a strong interest in clinical trials in these diseases. Yes, so this afternoon George Follows from Cambridge, Graham Collins from Oxford and myself are discussing indolent lymphoma, how we measure success in terms of response to treatment for follicular lymphoma particularly, and also where the unmet need is for patients who fail first-line chemoimmunotherapy for follicular lymphoma. And these are a really challenging group of patients whose disease relapses or progresses, particularly within the first 2 years of starting treatment. And it's clear from retrospective data that these patients have a poorer overall survival. And we're going to be reviewing some of the data that was initially presented at ASH 2016 by Bruce Chesson, which is an update on the GADOLIN study, which was a randomised phase 3 study of Bendamustine plus Obinutuzumab with maintenance versus Bendamustine alone, which was considered at the time to be the standard therapy for the relapsed follicular patients. And what was quite striking was the overall survival advantage that's now seen with the Obinutuzumab arm. So these patients who receive Obinutuzumab at relapse and as maintenance live longer than those who don't. And that's sometimes quite difficult to show in indolent disease, the overall survival advantage rather than just PFS. And I think we're beginning to understand more about what these patients need, and the depth of remission is very important. In the frontline setting, we've seen similar data, certainly in terms of MRD negativity, and there was a lymphoma session yesterday where Dr. Pott from the German group showed some very nice data on MRD negativity in the first-line setting. That was in the Gallium study. That hasn't really yet translated into a clinical benefit, certainly not overall survival, although there is a PFS difference in those patients. So I think the depth of response and the quality of remission is important in indolent disease, and I think we'll explore that further in the session this afternoon.